Hey guys, Dr. Jeff Finley here.
And Dr. Jessica Finley.
And this week we are going to be talking about vitamin D supplementation. All month we've been talking about the benefits of vitamin D levels and sunlight exposure apart from the supplements. So this week we're going to actually talk about when can supplementation be beneficial.
The first study we're going to look at talks about vitamin D supplementation and its use to prevent acute respiratory tract infections. It states that vitamin D supplementation was safe and protected against acute respiratory tract infections overall. Now, here's two very interesting points here. Patients who were vitamin D deficient experienced the most benefit. Thus, if your levels are low, which you can get tested through a simple blood test, then you may have a higher benefit from supplementation. Secondly, those who took smaller doses more frequently, as opposed to a large dose once a week or once a month, had the greatest benefit. We have personally seen doctors recommend mega doses of vitamin D, like 50,000 IUs once per week. However, the research does not support this. Research has shown in many studies that smaller doses, more frequently administered through supplementation, have had better impact on the nervous system. Dr. Jeff is going to talk more about this.
So then we look at a couple other studies, this time two different studies that are looking at antibodies against the thyroid. Antibodies are what commonly appears in something like Hashimoto's, which is an autoimmune condition where your immune system attacks the good healthy cells of your thyroid. The antibodies are ways to measure how severe the attack is or to what degree the disease is affecting you to the point that you're releasing antibodies. They took a group of women, took their levels before and after their test, and their test was essentially they had a group who took about 4,000 IUs of vitamin D and a group who took 2,000 IUDs and another group that didn't have any supplementation. So what did they find? At the end of it, the women who were deficient, who took the higher amount, who had deficient levels of vitamin D, I should say, and took the higher supplementation of 4,000 IUs, they cut their TPO antibodies by about 50%, which is incredible. Even the group of women who had normal levels of vitamin D but still supplemented with 2,000 IUs still found a benefit in a lower level of their TPO antibodies. The group of women who didn't do any supplementation at all had no significant difference before and after with their antibodies. Now, there was a second study that was done that looked at a very similar thing, and this time they also looked at the other antibodies besides TPO and what's known as thyroglobulin antibodies, another test that can be done to look at the thyroid and its autoimmune disparities. And both of them, at the end of the study, improved with supplementation. But the greatest effect was, in fact, in the TPO antibodies, just like the first study that we talked about.
Now, we also want to point out here that there's no guarantee that your levels will be lowered. All right, there was another study that was done that shows that improved vitamin D levels had no effect on thyroid markers, like the antibodies or the overall health. Just like in our last video that we discussed the benefits from the sun that were independent from the vitamin D levels.
So that's also an important study. So often we get so focused on, hey, this works. But it's also important to point out that not everything always works so clean and pretty just because there's some research on it. So a good study there to show that sometimes you may be able to raise your vitamin D levels, but you may not fix your disparity or your health issue that you're dealing with just because research says that it will. Now, the last one that we want to talk about is more so supplementation guidelines. As we saw from the study, they made it pretty clear that it's okay to supplement anywhere between 2 to 6 IUs, and that's usually on like a daily basis. What we don't want to do is some mega dose once a week, just like Dr. Jessica talked about earlier. 50,000 once a week doesn't make any sense. It's not how we absorb sunlight to produce vitamin D in our body, so why would we supplement the exact opposite way that we try and get it from the sun? Small doses throughout the week is the best way to go. Now, it's also important to note that when you're taking vitamin D, you want to make sure that your vitamin D supplement has K2 in it. It's not absolutely important, but it's helpful to have it in there. Vitamin D has calcium follow it around. So whenever you supplement with vitamin D, calcium stores are going to follow it around. The benefit of having vitamin K2 with it is that it's going to tell the calcium where to go. So instead of getting deposited in your arteries, it's going to be deposited into bone, into teeth, into different areas that is appropriate for the calcium to go. So, like I said, if you're a little deficient, you may want to supplement with something a little bit higher, like the 4 to 6 range. If you are within a normal level of your vitamin D, then you probably want to stick around the 1 to 2,000 IUs.
As always, like this video and share it with someone who could find this information useful, and tune in next week.
Thanks, guys.
Thank you.